Afternoon. My name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. My areas of expertise encompass medical hypnosis and hypnotherapy, guided imagery or visualization, nutrition and exercise, my site being drdrmedicalhypnosis.com. In my site, there's a wealth of health and medical information for each and every one of you aside from the videos. Before I begin today's health tip, I would like to thank the hundreds and hundreds of people worldwide who have signed up to get this health tip, and also to all those people locally in San Diego who've given me their business cards to include them in this tip. Your connection to me through whether it's social media or not is extremely valued. Begin with a tip. Today's health tip is: should one be genetically tested for diseases? This leads to a great moral, social, and religious issues that need to be solved, and they can only be solved by you. What is a gene? A gene is a part of each and every cell in the body, housed in the nucleus or the center of each cell, and that determines each of those genes. One receives 50% from the mother and 50% from the father, which is then handed down to their children. And those genes stimulate cell growth and give you all your characteristics, your color of your hair, color of your eyes, your facial features, etc., because a child has inherited those traits from the genes that their parents give them. We know that a gene is present in certain types of cancer and other issues. But as we are ending the Breast Cancer Awareness Month in the United States, culminating this coming Sunday in the Komen annual run to raise money for cancer, I thought it apropos that we discuss the genetic components about breast cancer and whether a female should be tested or not. First of all, the gene for breast cancer is called the BRCA gene. BR for breast, C for cancer, CA for cancer, and then the word gene. There are two types of genes, the BRCA1 and the BRCA2 gene. These genes can be inherited from the mother to her daughters. Now, I have seen this on 3 separate occasions where sisters have had inherited breast cancer from their mother. The one sister develops the breast cancer, the other doesn't. Both of them have the gene. When you speak to them, everyone says they've been stressed out tremendously. Stress causes all one's physical and psychological ailments. If the mind causes, which it does, the mind helps heal or treat using medical hypnosis and hypnotherapy, guided imagery, or visualization. So when somebody says to me, the mind can't cause it, I don't denigrate them. I take the time to explain to them. There is such a thing called epigenetics. Epigenetics is the study of what turns on a gene, what makes the gene active. Genes are usually passive, but sometimes they become active. So the study of what activates the gene or turns it on is called epigenetics. 9 times out of 10, that gene is stimulated by stress and turned on. Obviously, I'm not talking about those birth defects, the genetic birth defects, and etc., that are present at birth. That's a whole different ball game and a whole different subject. I'm talking about genes that are turned on and cause cancer. If one checks the BRCA gene, your mother's got it now, you want to know, do you have it? If you do the testing for the gene, it is important for you to know whether you have it or you don't have it. Knowing that you have it does not necessarily mean you're going to get the disease. What does matter is if you're stressed, chronic stress, then you will get the disease and your sibling won't, or if there's no sibling, you're the only one, you might get it. The same holds true for prostate cancer in the men. In fact, if a mother has breast cancer, her son or sons are at increased risk of developing prostate cancer, so studies have shown. But if you do the genetic testing, you're going to live for the rest of your life in fear, knowing whether you will develop breast cancer or not. That in and of itself can be a stressful situation. Oh, I've got the BRCA gene. Oh, I'm going to get breast cancer. I'm not saying that you shouldn't, but you must be aware of the consequences of you doing that. Actress in the United States by the name of Angelina Jolie made world headlines when she removed both her breasts and her ovaries because her mother had breast cancer and she was afraid she might get it as well. Personally, I think that's rather radical. So how can you prevent breast and prostate cancer? The recipe is simple. Take 5,000 milligrams of vitamin D3 every day. It must be D3 and not D2, as D3 is the active one. Take the vitamin D3, 5,000 milligrams after your main meal. Drink 4 to 5 cups of organic green tea. Make sure it's organic, because some green teas contain toxins. And the third thing is take 2 to 3 heaping tablespoons of ground organic flax seeds. Place the flax seeds either in your cereal or within your salads, but take that. Now, if your physician might say there is no evidence that that works, tell them there is evidence. Dr. Mazansky has read the evidence and he's telling all of us, you are too busy writing your toxic prescriptions. You did not read the evidence. Folks, everything I tell you is what we call evidence-based. There is medical evidence from credible medical journals stating what I state. I don't suck things out of my thumb. So that is the recipe. Vitamin D3, green tea, and ground flax seeds. And then last but not least, try and avoid stress as much as possible. Because as I said earlier, in every single cancer patient, chronic pain patient, etc., stress plays a large role. When they undergo hypnosis, we are able to reduce the stress by various techniques, and once the stress is relieved, then the condition improves or dissipates. I've seen cases of cancer being cured purely as a result of my doing the hypnosis and guided imagery and giving them a nutritious anti-cancer diet and exercise. Some of those people refused any and all allopathic classical treatments such as surgery, chemotherapy, radiation, etc., but rather opted for holistic treatments that I deliver. If you or a loved one has breast or prostate cancer or any type of cancer, whether the disease is active or whether they are survivors. For their sake, not for mine, inform them of my website, drdrmedicalhypnosis.com, and allow them to go and purchase the cancer video. They will be empowered to help heal themselves. You will have saved their lives, and by default, it refers back to me. My name is Dr. Hillel Mazansky, and I thank you for listening to this weekly health tip.